Sometimes the footprints may be just that.
Sometimes the footprints may be just that. Not yet dead man walking.
Dan Vardat, who runs Medopad, a health technology firm in London, says conditions as varied as Parkinson's disease.
He says conditions as varied as Parkinson's disease,
depression and breast cancer
can
all have a distinctive effect on a patient's gait.
Can all have a distinctive effect on a patient's gait. He says that conditions as varied as Parkinson's disease, depression, and heart attack can all have a distinctive effect on a patient's gait.
He speculates that with enough data covering different behaviors,
He speculates that with enough data covering
speculates that with enough data covering he speculates that with enough data gait. He speculates that with enough data covering different behaviors,
He speculates that with enough data covering different behaviors,
it will be possible to identify digital biomarkers.
it will be possible to identify digital biomarkers. It'll be possible to identify digital biomarkers
Capable of predicting the risk of Alzheimer's,
capable of predicting the risk of Alzheimer's, capable of predicting the risk of Alzheimer's
or a heart attack.
or a heart attack. He speculates that with enough data covering different behaviors, it'll be possible to identify digital biomarkers. Capable of predicting the risk of Alzheimer's or heart attack.
Work by Dr. Topol has already shown that spikes in resting heart rate.
His work has already shown that spikes in resting heart rate. His work already has shown that spikes in heart rate, spikes in resting heart rate.
More common when people have an infection.
More common when people have an infection.
Allows someone with access to lots of Fitbits.
Allows someone with access to lots of Fitbits. Allows someone with lots of access to Fitbits
To see when flu is breaking out in the population.
to see when flu is breaking out in the population. Work by Dr. Topol has already shown that spikes in resting heart rate are more common when people have an infection. Allow someone with the access to lots of Fitbits to see when flu is breaking out in the population.
The recognition of such patterns
What is it?
is clearly a job that flu is breaking out in the population. The recognition of such patterns
The recognition of such patterns
is clearly a job for the machine learning techniques.
is clearly a job for the machine learning techniques.
Driving the current expansion of AI.
Driving the current expansion of AI. The recognition of such patterns is clearly a job for the machine learning techniques, driving the expansion of AI, current expansion of AI.
These techniques are already being used to interpret diagnostic tests.
These techniques are already being used to interpret diagnostic tests. These tests are already being used to interpret diagnostic tests.
Sometimes with real success.
These techniques are already being used to interpret diagnostic tests, sometimes with real success.
an AI system for prostate cancer diagnosis.
An AI system for prostate cancer diagnosis. An AI system for prostate cancer diagnosis. What?
Developed by the Karolinska Institute in Stockholm, has held its own against a panel of 23 international experts.
Has held its own against a panel of 23 international experts.
A 9-country trial is now assessing how much it can reduce the workload of doctors.
A 9-country trial is now assessing how much it can reduce the workload of doctors. An AI system for prostate cancer diagnosis, developed by the Karolinska Institute in Stockholm, has held its own against a panel of 23 international experts. A 9-country trial is now assessing how much it can reduce the workload of doctors.
But recent research published in the Lancet Digital Health
But recent research
journal suggests some caution is advisable.
Recent research suggests some caution is advisable.
Looking at around 20,000 studies of medical AI systems,
Looking at around 12,000 studies of the 12,020
some caution is advisable. Looking at around 20,000 studies of medical AI systems
Looking at around 20,000 studies of medical AI systems
that claimed to show that they could diagnose things as
that claim to show that they could diagnose things
well as healthcare professionals,
as well as healthcare professionals,
it found that most had methodological flaws.
it found that most have methodological flaws. Looking at around 20,000 studies of the medical AI diagnosis, that AI systems that they claim to show that they could diagnose things as well as medical healthcare professionals. It found that most had methodological flaws. 어렵네.
One particular worry with machine learning in general
One particular worry with the machine learning in general
is that bias in the training sets
is the bias in training in the training sets
from which the computers learn their stuff
from which the computers learn their stuff
can mean that the algorithms do not work equally well.
Can mean that the algorithms do not work equally well. Can mean that the algorithms do not work equally well.
For all members of the population.
For all members of our population. One particular worry with the machine learning in general is the bias in that training systems from which the computers learn their stuff can mean that the algorithms do not work equally well for all members of the population.
Medical research has a poor historical record.
Medical research has a poor historical record
on such matters.
Medical research has a poor historical record on such matters.
For example, when it does not match clinical trial populations.
When it does not match trials of the match clinical trial populations. When it does not match clinical trial population
to the population at large, or excludes women of childbearing age from trials,
Medical research has a poor historical record on such matters. For example, when it does not match clinical trial population to the population at large, or excludes women of childbearing age from trials.
Machine learning could bake in such biases.
Machine learning could bake in such biases. Machine learning could bake in such biases
and make them invisible.
And make them invisible. Machine learning could bake in such biases and make them invisible.
Excessive optimism that edges into barefaced hype.
Excessive optimism that edges into barefaced hype. Excessive optimism that edges into barefaced hype
is just one cause for concern.
It's just one cause for concern. It's just one cause for concern
about datomics.
About datomics. Datum. The excessive optimism that edges into barefaced hype. It's just one cause for concern. It's just one cause for concern about datomics.
Privacy is as always an issue.
Privacy is as always is an issue. Privacy is as always is an issue.
The amount of data that parts of the NHS have shared with Google.
The amount of data
that parts of the NHS
have shared with Google
has worried some Britons.
Has worried some Britons. The amounts of data that parts of the NHS have shared with Google have worried some Britons.
Conversely, some researchers feel hampered by constraints such as those of.
Conversely, some
researchers feel Britons. Conversely, some researchers feel hampered by.
Conversely, some researchers feel hampered by constraints. Conversely, some researchers feel hampered by constraints.
Constraints such as those of Europe's General Data Protection Regulation.
Such as those of Europe's General Data Protection Regulation.
Says Claire Gayrel of the EU's Data Protection Authority.
Says blah 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 of the EU's Data Protection Authority. Conversely, some researchers feel hampered by constraints, such as those of the Europe's General Data Protection Regulation, says Claire Gayrel of the EU's Data Protection Authority.
They see it as an obstacle to innovation.
They see it as an obstacle to innovation.
Ms. Gayrel treats that with equanimity.
Mr. Gayrel treats them with equanimity. Mr. Gayrel treats them with equanimity.
I don't think it is a bad thing to think slower.
I don't think it's a bad thing to think slower.
Especially in health.
I don't think it's a bad thing to think slower, especially in health.
As well as worries over what researchers or companies might do with personal data.
As well as
in health. As well as worries over what researchers or companies might do with personal data.
As well as what worries over what researchers and companies might do with personal data. As well as worries over what researchers and companies might do with personal data.
There are reasonable concerns over how safe they can keep it.
There are reasonable concerns about how safe they can keep it. There are reasonable concerns of how safe they can keep it, as well as worries over what researchers and companies might do with the personal data. There are reasonable concerns of how safe they can keep it.
A cyber attack on Premera Blue Cross, an American insurer, may have exposed the medical data of 11 million customers in 2015.
May have exposed the medical data of 11 million customers.